statin epidemic. So, in the natural health world, we're all well aware statin drugs, they're everywhere, they're bad for the body. But why? What's going on? What's happening inside of our bodies? What is going on? So for those of us in the room who are not aware of what a statin drug is, a statin drug is a prescription that's prescribed to prevent primary and secondary cardiac events. Their effectiveness of a statin drug is measured by how well it's able to decrease LDL cholesterol. And there's a few different categories: low, medium, high intensity. And then there are a few different types of statin drugs. They come in liquid form, capsule form, and some of them are even approved for usage in adolescents as young as 10 years old.
Wow.
It's not just your grandma, it's not just your grandpa. This is the next generation. This is truly an epidemic. So how do they work? Statins poison the enzyme HMG-CoA reductase. This is the rate-limiting enzyme for cholesterol synthesis.
Louder.
Okay, sorry. I'm going to hold this actually. Okay, is that better?
Yeah.
Okay. So, your body has a very complex regulation system for cholesterol. It's in every cell of the body. It's highly important. Your body does not make a mistake. This process is there for a reason. So when we cut things off at the beginning, there's going to be things that happen that go wrong, obviously. So your body's still in need of this cholesterol, obviously, since it's everywhere. So statin drugs, I will give them that they are great at lowering that LDL cholesterol because you can't make it. So now your body's looking for it. It's reabsorbing the cholesterol and redistributing it in the most important places. So moving on into the adverse reaction. So in order to understand why an adverse reaction happens, we have to understand what the half-life of a drug is. So half-life of a drug is how long it stays in your body. So these adverse reactions are due to the half-life because your body has receptor sites and natural detoxification pathways for all of the natural substances that you put in. When you take your supplements, when you eat your balanced meals, your body knows what to do. But when you're putting in these synthetic substances, there's no detoxification pathways. There's no receptor sites. So your body doesn't know what to do. It's sticking it in places that doesn't belong. It's clogging these receptor sites. It takes a lot longer for your body to get rid of these things. So the example of the Depo-Provera birth control shot, it's a synthetic form of progesterone. It has a half-life of 50 days. Natural progesterone has a half-life of 20 minutes. To put that into perspective. So if you're taking a statin drug once, twice a day, how long is that really staying in you? So, according to Dr. David Brownstein, an adverse reaction is any noxious, unintended, or undesired effect of a drug that was appropriately used. In other words, the drug was taken and prescribed appropriately, and an untoward effect occurred due to the usage of the drug. So, in the case of statin drugs, the HMG-CoA reductase, it's being poisoned. It can't function properly. You're cutting it from the jump. Like I said before, the body doesn't make a mistake, and now we're interfering in a very important regulation process. So I'm going to be honest with you, I could not fit all of the adverse reactions on this slide. So these are just some of them. I'm not going to read them all to you, but ALS or ALS-like syndrome, aneurysm, CoQ10 depletion, increased risk of infection, liver pathology, skin cancer, thyroid disorders, weight gain, muscle pain, memory loss. I'd also like to point out, it's kind of ironic that a lot of these symptoms overlap with symptoms of low cholesterol. And that kind of funny. So the stats on statins. So now that we've established this foundation, we understand what they're doing in the body, we understand these adverse reactions, why are they still being prescribed? Why are people taking these? Why are they being pushed? So a lot of people don't understand the research on statin drugs or prescriptions in general. It's a lot of medical language people don't understand, they're not familiar. It's hard. You fit these long, lengthy texts, and you have left with the conclusion paragraph, and you don't know what any of these words mean. So a lot of statin drugs, their research is done, and the product they're using is an NNT. So that is a number needed to treat. That's what these results are in the format of. So the research shows that statin drugs have an NNT of about 100, often in the 200 to 300 range. So this refers to the number of patients needed to treat with a drug or therapy in order to achieve a desired result. So if an NNT is high, it suggests that the drug or therapy is ineffective. That doesn't make sense after that. So let's do one of these calculations real fast. So an NNT is calculated using the formula 1 divided by absolute risk difference, or AR. The AR is obtained by the difference between the percentages affected of the treatment group from the control group. So depending on how your brain works, if you like percentages, if you like numbers, we'll go through both. So if a drug or therapy has an NNT of 100, that means that 99 of the 100 people did not receive the benefit of the drug or therapy, right? So that, in other words, 1 of the 100 people did receive the benefit. In percentages, 1%. 1% of people are benefiting from this. An ideal range for an NNT of a drug is between 1 and 4. Over 20 says the drug is essentially worthless. Back to the last slide, statins are shown to be anywhere 100 sometimes, often between 200 and 300. How many people are these really helping? So, benefits of cholesterol. Obviously, we're all aware there was a war on cholesterol, it's still happening. Cholesterol is found in every cell in the body. It's very, very, very important. It's the body's healing agent. We're very familiar, statin drugs are prescribed to prevent primary and secondary cardiac events by lowering cholesterol levels. When you have free radical damage, if you smoke, anything like that, that scars the arteries. Your body's sending that cholesterol there to help heal that. So if you're not healing the free radical damage, if you're not stopping the smoking, if you're not doing the things to stop it, your body's saying, you need more, let me help you. And all of a sudden, that's how we have these cardiac events. So then we have the brain. Most of the cholesterol in your body is found in the brain. It's very, very, very important. For your mind, so that's the wrapping around your nerves. It helps protect your nerves. That is basically all cholesterol. And then memories. There is a lot of research that shows that statin drugs, adverse reactions, a lot of memory loss. It's very common. So is your grandma really losing her memory, or is it her cholesterol medication? The synapses in the brain, the production of information is almost entirely dependent on cholesterol. It's very, very important. And then the endocrine system, so muscle aches. It's a very another common adverse reaction of statin drugs. Your body can't produce hormones, it disrupts the endocrine system. So that is, and then there's this infertility crisis that we're facing today. It can be partly attributed to cholesterol. There is a really good paper by Dr. Kim McBride. She talks a lot about the infertility crisis and cholesterol and the research supporting high cholesterol diets when you're trying to be pregnant. So alternative options. So what should we do instead of taking a statin drug? First, CoQ10, back on my other slide about adverse reactions, I did talk about CoQ10 depletion. It's another production of the melanoid pathway that's disrupted by statin drug use. So when you're introduced in this pathway, statins are introduced at the beginning of it. So you're disrupting all of the products, you're disrupting the entire system. So this also helps with the adverse reaction of muscle aches. The highest concentration of CoQ10 is found in the heart. So it's kind of funny that you're trying to prevent primary and secondary cardiac events. CoQ10 depletion affects the heart, but protects the mitochondrial DNA from oxidation. So in order for that cholesterol to stick to your artery walls, it has to be oxidized. So a lot of these things will help with that oxidation. And I would say supplement regardless. If you're doing the research, you're trying to figure out what to do, what's best for you in your situation, take a CoQ10. It'll help your heart, it'll help your brain, it helps your muscles. It's important. Niacin or B3 is a great option if your triglyceride levels are high. It's essential for cortisol, male and female sex hormone production. Some food sources if you'd like to supplement into your foods. Liver, lean meat, fish, eggs, avocado. Or if you're more interested in some herbal options, alfalfa, burdock root, cayenne. In large amounts or in large amounts and in combination with cholesterol-lowering drugs, it can cause liver damage. So do your research. Talk to your doctors. Make the decisions that work best for you. And some other alternative options. Ginger lowers cholesterol levels, and it prevents that oxidation that we talked about before. Fibers, specifically water-soluble sources, are great at lowering cholesterol. There's been a lot of research on that. Barley, beans, brown rice, fruits, and oats are great food sources, especially brown rice and oats. Walnuts, pecans, and macadamia nuts are also great sources, obviously raw and unsalted. And the trace mineral chromium is really another great source. A good purple source is the hibiscus flower. And then garlic. It contains allicin, which blocks the bacterial enzymes by reacting with fuels. It's a crucial component of some enzymes that participate in the synthesis of cholesterol. But if you're looking for an alternative option that doesn't block any or alter any enzymes or anything like that, this may not be the option for you. So, in conclusion, statin drugs, they do more harm than good. They are still so heavily utilized and prescribed. They generate lots of money, and there's a lot of understanding of the research. So, look for why your cholesterol levels are high. Look for what's going on. Look for the reason why, and treat it at the source. Don't just put a band-aid on it. And then, at the end of the day, it is your health advocate research. Do what's best for you. Make the best decisions for you. You do the best you can with what you know, but the more you know, the better you can do. So it's a good thing you guys are all here today.